So, hello, welcome back. I hope you're all well caffeinated or orange juiced or whatever the verb is. It's really great to have kicked off this morning with so many powerful speakers and some really strong messages there. I know there's so much that you'll want to take up. We very much want to encourage your questions. Forgive us if the dazzling lights here mean that we don't pick out your arms, but wave your arms as and when you want to raise a question here in the room. Online, keep putting those questions in via Slido. We do want to hear from you. And again, anyone in the room can use the Slido app to put the questions. But I'm very aware that in the audience here, we have some fantastic delegates and representatives from all sorts of different stakeholders, and we'd love to hear your voice too. Now, you can see that we have ready and waiting an amazing panel, and they are very, very eager to get going. But just before I introduce them to you, let's take a moment to remember that it's about patience, as was said earlier. And we want to hear now, before we get into our digital transformation session, from the patient expert on why it's important to get digitally savvy, whatever age you are. Let's hear from Jenny Camaradou, who is a British Greek national, a Upati patient, and a health tech bid writer. Here's her video message.
Good morning, Kalimera, bonjour, good morgen. My name is Jenny Camaradou. I'm a half English, half Greek Upati trained patient expert, an assigned member on the UK NICE COVID expert panel, COVID End, evidence synthesis, and also a participant in several different European projects. Concerning the first recommendation on data, I think patients would welcome the added emphasis on accountability, governance, and agency as they become increasingly more familiar with the commercial value that their data has and also the secondary data usage issues. I think the focus on providing an additional layer on assurance around privacy and data security would be very much welcome. Concerning the second recommendation on creating an ecosystem for artificial intelligence collaboration from work that we have undertaken in the United Kingdom, we have found that AI needs to be far less opaque and more explainable to people from different backgrounds. And when reflecting on what makes an AI digital trustworthy, people are actually acutely aware that the trustworthiness of the entire system is central to the trustworthiness of the technology itself. So both public and clinical acceptability of AI and perceptions of AI actually differ according to case studies. So they differ according to how you will utilize the AI. Through my involvement with the Tripod Statement, which is about prognostic and diagnostic accuracy reporting, Consult and Spirit AI, which is about how we run clinical trials utilizing AI, we have observed that the integration of patient insight has to happen at a much earlier stage of the development process. So there is definitely a need for deliberative dialogue, for shared responsibility, and in particular with regards to implementation issues. So issues around algorithmic bias, explainability, reproducibility are actually less important to patients than transparency reporting, comprehensiveness, and impact. So I think the key is to consider iterative evaluation. So for me as a patient, it's really more about looking at AI as not as one part of healthcare, but rather as a small part of a much bigger pathway, and about thinking holistically, how do these technologies achieve and reach the best outcome, and how can we communicate that clearly with patient involvement. So the emphasis of the recommendation on cross-disciplinary thinking is very much welcome. Last but not least, the final and third recommendation on digital technologies and skills development would be very much welcomed by patients as a way of creating more balance along different developing stakeholder needs. So I think we need to marry up data science skills with clinical pathways redesign and healthcare improvement quality initiatives to make health systems more sustainable. And this will be key for preventative health, which matters to patients. On a second note, I would really like to find out whether or not AI ethics is going to form an integral part of any medical educational training, and or perhaps also part of citizenship or democracy studies for schools. If we're teaching our 8-year-olds how to code, should we also be teaching them how to think about sentient AI and what that may mean morally or legally? Overall, these recommendations are very much welcome. Thank you for your time.
Thank you to Jenny. Gosh, sentient AI. I'm sure this panel know what that's all about. And some great ideas there. The key things then on transparency, on ethics, and on education, and on not being afraid of AI, which is not the future, it's already with us, as we already know in so many examples in clinical practice. So, to get into the panel, I am delighted to hand over to an excellent moderator. We have Annabel Seebohm here, who is the Secretary General of COSIA, the European Coordination Committee of the Radiological, Electromedical, and healthcare IT industry. Welcome to you. You've got a great panel. Next to you, we have George Valiotis, Executive Director at the European Health Management Association. Also MEP Tomislav Sokol, who is the co-rapporteur for ENVI at the European Health Data Spaces file for the European Commission. Welcome for the European Parliament. And next to him, we have Martin Dorazil, Deputy Head of the Digital Head Unit at DG Santé. Welcome. And also welcome to Professor Ilona Kickbusch, who is the founder and chair of the International Advisory Brand Global Health Institute at the Graduate Institute in Geneva. And on the far side there, MEP Cristian Bușoi, chair of the Industry, Research and Energy Committee, also a doctor and a former president of the Romanian National Health Insurance House. My gosh, what a panel, Annabel. Annabel, over to you.
Thank you very much, Sue, and good morning, everybody. Good morning, ladies and gentlemen, to the Digital Transformation Panel. What does it take to build a real European health union? And we discussed this already in the previous session, which is focused on people, better care and innovation so that we are all better protected and our systems perform better. One of the 6 pillars of the European Health Union is the Digital Health Union. You remember the Commissioner outlined, we have the Crisis Preparedness Package, including 3 pieces of legislation. We have the pharma legislation revision. We're having the Europe's Beating Cancer Plan, but of course we also have the Digital Health Union, and that is the European Health Data Space, which we will be talking here about today. And Commissioner Kyriakides said, this is a game changer. She said, this is a game changer for the digital transformation of healthcare, but we need to have the infrastructure, the data security framework, and the mindset to use its opportunities. So how to make it happen? At the EU Health Coalition, we were developing 3 recommendations on the digital transformation. And for the sake of time, I briefly outline them to all of you. Our first recommendation is, and COSI was chairing this work group, if I may say, our first recommendation is to enable the collection, and I put it short, of good health data in a secure manner to improve healthcare delivery, to enhance research, to have better efficiency in healthcare systems. Our second recommendation, and this is what Jenny was in the video was elaborating about, is the enhance a trustworthy and ethical use of AI via building an ecosystem which is multidisciplinary. And our third recommendation is invest in infrastructure, invest in digital technologies, invest in skills, as these 3 things are the key drivers to make the digital transformation a success. So I briefly outlined to you our 3 key recommendations, which we will discuss now in view of the European Health Data Space in particular. But to start with, and I know Mr. Bușoi, you will be leaving at 12:20, so don't be surprised when he suddenly gets up. This is all planned for, because you're having an urgent commitment coming this afternoon. But to set the scene maybe on the digital transformation and what's currently happening, I would like to turn to Mr. Dorazil and ask you, given your engagement in building a European Health Union, including a digital European Health Union, what is the Commission currently proposing on the European Health Data Space, on AI, on investment in skills, etc., and how do you see our recommendations fit?
Thank you very much, and good morning, everybody. It's a pleasure to be here. As you very rightly said, the proposal for the European Health Data Space is an essential part of the Commission's work on towards the European Health Union, and it's one of the essential pillars. It is part of a, let's say, long-term planned work of the Commission, but obviously the COVID pandemics provided important acceleration into the work, and the COVID pandemics demonstrated very clearly how important health data is, how important timely and efficient and at the same time secure access to data can be, and it can be even life-saving or very, very important in times of crisis, but also in so to say, peace times. So earlier this year, in May, the Commission adopted a proposal for the regulation on the European health data space. What we are proposing, what are the objectives of the work on the European health data space, can be summarized, in three points or three main objectives. First and foremost, the citizens and patients are the most central part of the proposal. So the first objective of the proposal is to provide citizens and patients with better control over their health data, and to enable easier and at the same time secure access to their own data. So that's the first objective of the proposal. The second main high-level objective of the proposal is to unleash the potential of health data and to create a genuine single market for digital health products and services by providing common specifications and common requirements for the products and services that are being used and placed on the Union market. And third, and this is quite novel area, at least at the European level, we are aiming to establish a robust framework for the so-called secondary use of health data, so for the reuse of health data for purposes of health research, health innovation, or for the decisions or activities of health regulators or public authorities. So these are three main objectives of the proposal. We are building on previous activities and initiatives, for example, on the work of the member states in the context of the e-health network. But we are making a next step and providing a solid legal framework for this. Activities will certainly help to provide an efficient way for accessing health data. But providing the legal framework, and this is what we are doing with the proposed regulation, in itself will not be sufficient. That's very important first step or first part, but it needs to also be accompanied by support and work on the appropriate technical infrastructure to allow, especially in cross-border situations, for the access to health data. We also need to support and work further on the improved quality of data, because only if we have data of high quality from the outset, they can be later used and reused also for the secondary purposes. And we also need to support capacity building in the member states and digital skills for those that will be using the data, so being the authorities and administration, but also health professionals and patients, of course. So this, there is a lot of work ahead of us. I mean, the proposal for the regulation is just a first step, and currently the proposal is being considered by the Council and the European Parliament, and we hope to see as soon as possible the final version of the regulation formally adopted, so that the work on the implementation can start. Thank you.
Thank you very much, Martin. And I directly turn to the European Parliament, to Mr. Sokol. May I ask you, what do you think will be the most challenging or contentious issue you will face in discussing this proposal with your colleagues?
Secondary use of data. So to be very direct, but just to explain a bit the whole procedural thing. So once the Commission comes up with the proposal, then the Parliament and the Council have to both approve it. But within the Parliament, first we had to choose which is the lead committee, which will be the committee in charge of making the report. And first, the first decision was to give this to LIBE Committee on Civil Liberties, and we challenged this because we thought that this is primarily a health issue. So for us from the ENVI Committee on Public Health, and finally we were able to get the joint rapporteurship. So now we have two rapporteurs. I'm from the health side, from the ENVI Committee, and colleague Tardino is from the LIBE side. And this is where I think the first point of contention comes into play, because I think one of the main challenges, especially related to the secondary use of data, will be about how to balance, on one side, the necessity to use data to open up the market and to exchange data, with the necessity to provide data protection. And I think some of the main discussions will be there, especially what is the relationship between this regulation and the GDPR. And we know that GDPR is this kind of a broad horizontal regulation which is being implemented by both public and private persons in different member states. We know that we have a lot of different interpretations, different ways how people understand the GDPR, which is one of the big problems. And what we will hope to avoid is for this to repeat also in this case. For instance, I teach at 2 universities, and for instance, these 2 universities have completely different interpretations of the GDPR in terms of when we can publish student records, student results of the exams, whether it should be under password or not, things like that. So this is something that we will have to clarify. Also, we will have to clarify a lot of the concepts within the definitions part. This is something which we already discussed a lot with the stakeholders. So they will, especially how to delineate the concepts from this regulation with the other regulations which are regulating the same issues, like the Data Act and things like that. So other pieces of legislation which we either already have on European level or are also in the process of being adopted. So how to make all of these different regulations which regulate similar things fit together. And also the problem will be about the governance. I expect that with member states in the council there will be a lot of discussions there. Member states always never like to give too much, to create new additional bodies on European level and giving them too much power. So I expect a lot of discussions will be there. Also on the governance part, especially on the board, I think I will personally work to give more power to the stakeholders, like the patient groups, industry. I think that's important. I think this is an area where the proposal can be improved. We will also try to define things as clear as possible, so that we don't have too much delegated regulations from the Commission. Of course, we know that we need some, but I'm a lawyer and I personally prefer to have things as clearly defined within the regulation as possible, so that we don't have these delegated regulations afterwards, because that affects legal certainty. It's not the best way how to do things. And also on the infrastructure, I think that the Commission puts too much emphasis on the existing legal instruments like the RRF, which were made before we had the HDS. So when member states were planning their funding for RRF, for national reforms, etc., some of them didn't have in mind the HDS and the additional costs that it will bring. So I think that we should not focus that much on what we already have, but actually to try to find where we can provide additional tailor-made specific funding on EU level to support the creation of the health data space. So I will also try to work on this kind of providing this additional funding from the centralized level.
Thank you very much. I would like to turn back to the secondary use and the question, because you said there is a necessity to balance, let's say, the use of data with the necessity to protect data. However, and I would like to turn to you, Mr. Bujoy, because when we also need to think about the overall question, when is digitalization actually beneficial for patients? And putting this to a higher level, when do you think is the digital transformation actually beneficial for patients, and what are the key elements needed for this to be beneficial?
Thank you so much. Clearly introducing and boosting digitalization in the healthcare systems at the level of regulatory authorities, for instance, would make a difference in improving efficiency of the healthcare systems, but also will enable patients to have access to healthcare and to innovation in health, will enable authorities to fast react in critical situations, and also will empower patients to manage their own diseases. Of course, European health data space is just a part of the effort to digitalize our health systems. I'm also responsible on behalf of ITRE committee. I'm the chairman of ITRE committee, but I'm also the rapporteur for opinion for this European health data space. We try to get some more prerogatives, but it will be soon decided which committee does what in the European Parliament. Anyway, by the middle of January, we'll have to present the opinion in ITRE committee, and then we'll have, of course, the cooperation with the main two committees, and I'm happy that a very good MEP like Mr. Sokol is in charge on behalf of ENVI, having a very good vision for what we should do and improve the already good initiative of European Commission. But clearly here we set some rules, we give some inputs, some incentives. We have to do more than that. I was also, and I am the rapporteur of EU4Health program. And one of my priorities in EU4Health program, supported by European Commission, and also at the time it was the German presidency, and the former minister, Mr. Spahn, was also very committed, was to introduce the digitalization of the health system as one of the priorities of EU4Health program. Of course, the majority of funds will go to the stockpiling and to better prepare and to the initiative of European Commission to have the necessary tools to prepare for future pandemics. But here we introduce the idea of have a European health record, electronic health record, and we explicitly put as a priority the use of funds for health data space future platform. So beside RRF, of course, EU4Health could provide some funds in order that what we legislate with the data space should be also implemented. Then, in order to reach our goals, you mentioned and asked me about this, we should use also the Digital Europe program. We could find good opportunities there. And beside the RRF, and at least my country, Romania, already started a program of digitalizing the hospitals with the help of the RRF funds. We could use also the cohesion funds, because there we could use EU funds for e-health solutions. Of course, it's not necessary the use of the data. Clearly, here we have to make the best rules, but other initiatives could be funded by from European funds. On the secondary use of data and the whole idea of European health data space, the input of ITRE committee will be to find the right balance, because we need to engage industries, we need to engage patients, and my opinion would be that we should not do a very strict and sometimes difficult to implement legislation like GDPR, because the research community, the industry is sometimes complaining that GDPR is not an enabler, not an incentivizer, but sometimes a barrier in using the full potential of clinical research, for instance. And this is not the input only from European, but also from our main partners. United States, for instance, said that GDPR is the main barrier in the good cooperation in the clinical trials and future common projects between European Union institutions and the United States.
Well, let's hope that the GDPR discussions become not repetitive while discussing then the EHDS. But linking back to our recommendations, which were about enable the collection of good health data, sharing good health data, and enhance trustworthy AI and investments. May I turn to you, Professor Kickbusch, from a global perspective as a global health advocate for a digital health union? What do you think? What else do we need not captured in our recommendations? And I know you were part of co-authoring a report on governing health futures 2030. And is there anything which we didn't capture, or the European health data space doesn't capture, or the AI draft legislation doesn't capture? What would you like to raise, which we should think about?
Well, thank you very much and good morning. And obviously, if we're talking digital transformation, there's hardly anything that is more global than the digital transformation. And therefore, any regional activities, wherever or national, need to keep that global dimension in mind. And therefore, it is very important that as one shapes a European health union, one shapes that global dimension at the same time. And as we know, there are an incredible number of governance gaps at the global level, and therefore, as the European Health Union is shaped, and we saw that with the GDPR as well, there is, a Brussels effect that will happen. And therefore, as one shapes the European Health Union, in this case, its digital dimension, and somebody said this morning, which I think was very important, we are talking about two key strategic sectors at the same time, health and digital. And there is hardly anything that's more valuable at this point in time than health data. We are faced with a situation that if you look at it globally and you look at digital health governance models, or let's just say then digital governance models, you have very different approaches, and we will see it with the G20 presidency of India. We have, different approaches to digital governance in India, in China, the United States was already mentioned, and therefore the value-based framework and the principles with which the European Union is shaping its overall digital approach, but then its digital approach to health data is absolutely critical, because what our commission, the Lancet FT Commission, saw is that in a whole number of cases, health data are used as the entry point to actually gaining more information on citizens, on people, actually stripping people of their rights as citizens. So this interface, the youth speaker said that earlier, between the digital transformation, health and democracy is something that is so critical, and which is why the role of the EU in having a value-based framework, which then, last not least, in cooperation with WHO, that is working on setting norms and standards in this area, needs to be shaping digital health governance globally. There's an additional dimension, and that is the partnership with others. And of course, there is the whole issue of investing to reduce digital health inequities, both in terms of population groups, but also countries. And that, of course, on the one hand, is within the Union itself then, and I'm sure we'll hear more about that. But also there is no other way for the European Union in general than to address the underinvestment in digital transformation in low and middle income countries. Quite bluntly, if Europe doesn't do it, others will do it, and they will do it with other models. And there is a lot of geopolitics that is happening here. And we heard about the secondary use of data, but there's a lot of interest in terms of the corporate interest, not only, the health research interest here that needs to be taken into account. And so I think we need to be very, very clear as we talk about, investing in a global, robust surveillance network, for example, in relation to pandemics. If we think about cooperation on fighting infodemics, I mean, that was one of our key challenges during the COVID-19. All the false information that came in through platforms that were not subject to any kind of governance at all. So I think, and finally, if we want to invest, where do we get the money from? I mean, there is exploration of corporate taxation on the digital economy, which also we find is still a very important thing to take into account. So those are, I guess the short message is, whatever you do in the European Health Union on digital, keep the Brussels effect in mind, and keep in mind that this is a part of the world that still takes human rights seriously, that takes women's rights seriously, that takes citizens' rights seriously, and that has to be the focus.
But thank you very much, Ilona. Before turning to you, George, and I'm very sorry, but having heard how important the role of the European Union in the digital transformation is, how come, Martin, that member states already raise red flags? How come that there is opposition, that there is, well, coming from Germany, I've read some of the papers, how come, what are the key issues? Why are member states reluctant? Maybe briefly, because I want to give a chance to George.
Yeah, first of all, I wouldn't be so pessimistic. I think there are technical details, for example, on the proposal that is on the table to be further discussed. But we had a first, let's say, high-level political discussion among the health ministers in June during the EPSCO Council. And overall, the reactions from the politicians were very positive. And I didn't hear any voices, challenging the overall objectives, for example, of the initiative. Of course, there is still work to be done on the details and the exact, structure of the data space and the proposal. But I think the objectives are acknowledged and recognized also by the member states.
That's reassuring.
Yeah.
Turning to the skills aspect, in our recommendations of the EU Health Coalition, we have a third recommendation on the necessity to invest into skills. And for you, George, how does actually, from your point of view, the workforce adopt the digital transformation in everyday practice? Do they have the necessary skills, and how do they tackle this?
So I would start by saying I work at the European Health Management Association, and health managers sit in the middle between where policy making happens and where practice is delivered. So they are the people who, once whatever policy is introduced, these efforts don't magically happen. You need a manager to say, okay, let's upskill and reskill our people. You need managers also to have the skills to know what to upskill and reskill with. What our members also would tell us is that digitization is not just a technical thing, it's a relationship issue. So don't just think of digital as computers and machines, think of it as people and relationships. So like right now in Norway, there are people in care homes who are living independently and struggling. And if they have a fall, a nurse gets called to their home and she or he lets themselves into that house to help that person up, if they have the key. If they don't have the key, they can't get in. And so an innovation that happened in Norway was to digitize all of the door and lock entry components. And it therefore means that nurses can have free and direct access. So in terms of thinking of integrated care and home-based care, this gives great independent living to people. But in order just to do that, technology required a lot of competency-based training to give the care workers the skills to use these new facilities. You also then need the administration to have the technical skills to manage these innovations. So we're talking about the data space, we're talking about GDPR. How do you then have the skills to manage and uphold these things legally and appropriately? Upstairs, we have the interactive drawing thing. Did everybody have a little colouring in of that? It was really fun. And we can say to you, here's an analogue skill that you've not done before, or maybe you've coloured in before, but we want you to collectively design a picture together. We can do that. But if I asked you right now to go upstairs and program that so that it can light up and respond to our touches, could you do that right now? No, you might have the health, or maybe some of you could, apologies, but it's one thing to have the literacy to understand how these innovations happen. The other thing is you need the technical competency skills. You need the official training to do that. Health managers need the competencies to also measure these things and develop it. We need to be working with academia to also measure these skills, to define the emerging occupations. In practice right now, I gave you the Norway example. We've seen digital records also introduced in a lot of countries, and we've also seen them go back to analogue because it wasn't working, it was too hard. And then we see them again being pushed into digital again. So again, these are technical competencies that need in their practical management. We see a lot of technologies like in radiography, all the machines you can see when you're in the hospital. I've mentioned some of the technologies in the community. We also, right now, across all of Europe, we have patients wearing wearables and using interactive apps to be engaging on their non-communicable diseases or their chronic diseases to better manage those. Those things are in practice now. We've been developing skill sets for that now. However, there's a lot of new occupations. So Emma, where I work, we've been asking for a way to collaborate across all of Europe. Dr. Azzopardi-Muscat very well said earlier around the wicked problem of the health workforce. We know the health workforce are under a lot of stress. So how do we alleviate that stress? because digital innovations requires extra time from them. It doesn't necessarily save them time immediately. We want to make their lives easier by introducing efficiencies, and for that we've called for a strategy on upskilling and reskilling, and that's been funded by the Erasmus Plus program, or co-funded by them, by the Commission, so that's great, that starts us off. But it means we're in this moment of time where we've got some technologies being used now, great. We know we need a lot more skills. Think of future occupations like data management, all this stuff on GDPR. We need to see the skills building in that now. And then I want to just come back to this idea on, because you want to roll me on it's a relationship issue. So we need to be talking to patients all the time, and that we're building the skills that are needed, and we need to be asking the questions of what's coming in the future by talking to people. So make sure you're involved in these conversations. It's not just about machines, it's about people and relationships.
Indeed, thank you very much. And Mr. Bujoy, before you have to go, I would like, how do we actually implement the asks by Mr. Valiotis? How do we bring everybody on board at EU level, but also at national level? Do we need to rewrite curricula for professions? Do we need to give special courses? What is your idea about this?
Yes, I'll have to chair a meeting at 12:30 in the Parliament. Sorry for that, but happy once again to be here. Clearly, we need to engage with the member states. I totally agree with the European Commission, and I have the same assessment that we'll find a common ground for this regulation. The big problem is to convince everyone to go with the same speed in digitalizing and using the digital solutions in the healthcare. And here, there are still disparities. Sometimes the disparities are not the same that we see in the access to treatment, for instance, or to access to innovation between West and North and Central and East Europe and South. Sometimes you see some good initiatives in the Baltic countries or even in the Central and East European, some advanced projects to digitalize the health, and not necessarily the same level of political commitment in some other countries. So here, from the EU level, from the Parliament, from the Commission, first we need to put a positive pressure on the member states to implement some projects, to be part of this transformation of the health sectors in the European Union. Clearly, mobile health, and you mentioned some applications in Norway. I'm sure that many other ideas are present in some other member states, are extremely useful. Also, I saw a lot of useful digital solutions for patients in the private hospitals. At least in my country, Romania, the public hospitals are not so much advanced. They are still old school, old style, with a lot of paper and a lot of interaction, which is not really facilitated by the digital tools and by the mobile. So here from the private sector, we could have some inspiration, but clearly we need on board all member states and see where they have reserves and how we can align everyone to really make a leap forward, to really make a significant progress during the next years in order to see a digital health sector in European Union.
Thank you. Going back to the global level, the EU, and thank you very much, MEP Bujoy, and
Thank you.
Good meeting for you. Turning back to the global level, we're currently working, or the EU is currently working on a global health strategy, including a view on digital. And how do you see the EU's efforts in this respect? Is the EU on the right track?
Well, we'll have to wait until we see the strategy, obviously.
Questions, when you look at the questions.
It's very clear that digital is one of the key enablers also in the whole global health arena. And particularly if you try to address a whole range of inequalities. And through our commission, we had conversations and surveys with young people all around the world, particularly in sub-Saharan Africa. And their key interest was to have a digital-first access to health, and particular to reliable health information, and also first diagnosis and care. You know, they raised issues like mental health, that was also discussed this morning. The girls raised reproductive health information. So there's a significant universe out there, and there is users out there who, in terms of working together globally, and I would say co-producing the issues at hand, because they know what attracts them, they know what they want. So that one could move forward there quite significantly. But take the inequality. We spoke to a young man, and he said, every morning I have to make the decision whether I eat or whether I go online. So those are the choices out there that are very, very stark. And I think, the critical issue, and that is what we've learned through work in global health development, is go local. Speak with the people. The focus has to be on primary health care. We are a little bit, I think, as important as it is, too focused on the whole pandemic, security and everything. It's incredibly important. But, what will make the difference in the end is a sustainable health system and access, really there in the community. How can, this digital device help a community health worker? And, I could quote loads of examples, but none of them are taken to scale. Point one. And that's where the European Union could help. And none of them are really being picked up by governments. And I think here that interface is really important. One last thing perhaps I'd really then like to raise is, which is why in our commission we started to speak about digital health citizenship. And that is, a full involvement in this digital transformation. And it's not just about patients, it's about citizens and their health, it's about digital determinants of health. And here I think in how one constructs these programs, one could take a quite different approach. And there are people who are doing that, but as I said, it's all these small pockets, and I hope the European Union with its global health strategy and the investments can make a difference there.
Thank you. Colleagues, I invite you to raise your hand and ask questions to our distinguished panelists, so please feel free. I see a hand up there. I don't know your name. Maybe you could briefly introduce your, and I can't even see, the light is very... Is there a microphone?
Hi, can you hear me? Yes.
Yes.
So, hi, my name is Paul van der Verf. I work at FIPA International, so a consultant here based in Brussels. So I just want to go a question a bit on the practicality on the deliverables for the future. So particularly, is the idea is to make a centralized app for citizens to access their health data? And my second question is, will this data access be hierarchical, in the sense that citizens will have a certain access, industry will have more access, and then the governance will have another kind of access?
Well, I guess to have a European-wide app for an electronic health record, this is very ambitious, but I turn this question to Martin and to Mr. Sokol about your plans and your opinion about this question.
Okay, so I can start. Thank you for the question. With regard, to what we see as the deliverable of the European Health Data Space and the regulation is indeed it should be an easy or easier than today and at the same time a secure access for individuals to their health data. Whether this will be done through a mobile app, it's difficult to predict at this point, but for example through a platform that will enable them an easy and real-time access to health data, that's what is expected. But how exactly this will be implemented, it will be also partly depend on the member states. The regulation sets out the right for the citizens to have easy access to their electronic health data, and at the same time an obligation for the member states to ensure that. But the implementation will then provide some of the technical requirements for that. I don't think it will go into that level of detail, whether this will need to be through a mobile app or whether this could be a web-based central platform. And so on. But what is also important to say, and that applies more to the area of secondary use of data, we are not proposing here a central database at the EU level of citizens' data or of health data in general. The data will stay where they are. What we are just facilitating is access to the data through the federated model, but we are not creating a centralized database at the European level.
The second part of the question, what about hierarchy of access, and maybe Mr. Sokol, you would like to, do you have some opinion about this? Who should have access and when and how?
I have a lot of things to say. I didn't have much of the speaking time here, so it's different ways how things will be accessed depending on the type of use. So when you speak of primary use, the whole idea is that the medical this will be especially important for cross-border healthcare. So, for instance, if you go to study or go to stay in another member state for 6 months, and then you have to go to see a doctor, that this doctor gets access to all your health data, that this doctor doesn't have to do additional new diagnostics and repeat things which were already done, etc. So this is one type. When we speak of secondary use of data, if this data will not be automatically accessed, it will have to be on basis of request by. And of course, those who request data for research innovation purposes will have to prove and explain why they need it, etc., etc. There will be also conditions which data can be used, so anonymized, semi-anonymized, etc. So it will not be the same, and it will not be automatic, especially for secondary use of data. But I wanted to also come back to some of the things which were mentioned before. When you speak of curricula, no, we cannot harmonize legally curricula on EU level because it's a national competence. So we can share best practices, we can try to provide incentives for the member states to adopt certain curricula, but we cannot prescribe by law and say you have to. This is the common unified curricula which all member states have to have in common. So here possibilities on EU level are limited, but we can provide incentives, exchange best practices, and by doing this we can achieve a lot of unification in practice. And the same goes with the ethics. So regulation of ethics is also primarily a national competence, and I think there we have a lot of suggestions to also try to put some ethical principles here in the regulation, but this will be definitely challenged, I think, by the member states. So we will have to be really careful and try to find the right balance there. Also, when we speak of the one thing that I forgot to mention in general, I think the Parliament's position, at least my position, is that the basic principles are good. So we want to facilitate the use of data. We want to make it easier for data to be used. We want to make data to be interoperable. We don't want to create additional obstacles. And GDPR has, in practice, created a lot of obstacles. We would like to remove that. So we want to make it easier for data to be used when compared to today's situation. And in that sense, I personally support the basic principle of the Commission proposal and basic objectives. But what we will try to do to improve all of these details, which in practice are very important. And just also on the use of data, why data is also very important. One thing that we forgot to mention, and that I think is crucial, is the real-world data, which should be used in many areas, especially for rare diseases, where we cannot conduct phase 3 clinical trials because we don't have enough patients. So use of real-world data is essential there, but also for policy decisions. We saw with COVID-19 that we had different methodologies of gathering data, for instance, on the number of hospitalized, on the number of people who died from COVID, etc. So this is something which is problematic. So we need more data. We need common methodology also how to use data if we want to also make really informed policy decisions. Because when we speak of COVID-19, we in many cases compared apples and oranges, and this is why this common European approach didn't function in the end. And one last point, importance of cohesion policy. Cohesion policy is important because differences are so big in different member states. In some member states, we don't have basic infrastructure in many regions. And in member states, we have a big problem of workforce. Especially in my country, in eastern part of Europe, we have a big outflow of healthcare professionals, not just doctors, but also nurses who emigrate to the West. So we need to use cohesion policy and other European funds more to reduce these differences. I was also rapporteur on this in the Regional Development Committee. But what is important is that we actually measure how these European funds actually contribute to improving health outcomes. And this is what we don't have on European level. In the end, this is something that we will also have to work on. Thanks.
Indeed, and that's very much in line with our third recommendation of our EU Health Coalition recommendations. Thank you very much. Since we are running out of time, I'm not taking another question, but just as a take-home message from you, just very, very short. Where do we stand with the digital transformation of the Digital Health Union? What is your ideal wish on your wish list? What comes first? George?
My wish is that we don't see digital as in itself. It has to be looked at with green skills, because we're going to destroy our planet unless we also know how to recycle these machines, how to fuel them with energy that is safe to use, that is better for our planet. So we need to look at digital skills and green skills together.
Mr. Sokol.
Yes, I think with digital, it's important that we don't just use digital to enhance the methods that we're already using, but we have to do them to work better and to work in a different way. I think that's crucial. We have to invest more on EU level. We have to create these basic conditions that we can apply the new digital solutions, and we should find a consensus on health data space, because we need to really facilitate the use of data if we want to have more efficient healthcare systems.
The Commission will be pleased to hear that. Mr. Doratzel, your wish list.
I don't know if it is a wish, but I think it's important not to consider the digitalization or digital health as a goal in itself. It's a tool, it's a very efficient tool, but the main objective of all these efforts should be to make the healthcare systems more efficient, to come with new therapies and treatments, and to provide benefits to our patients. So we should always bear this in mind. So that would be probably my wish.
It's clear. Professor Kickbusch.
Yeah, I'd first like to add to that wish that it's not just about the health system, it's about the health of populations. And therefore, the digital can contribute a tremendous amount. And that links again to my push for digital health citizenship. Any digital transformation in the European Union fully needs to involve young people, citizens, patients. And they are already active. I don't agree with Lynn, who said patients just want good services. I think patients want to be involved fully. They need to understand what happens with their data. They contribute their data. And citizens want to be part of a local environment that actually promotes health. So as we look at digital transformation, please, let's not only look at the health service side of it, let's also look at the health promotion and the prevention side of it, and the full involvement of citizens. Thank you.
Thank you very much, and please join me in thanking our dear panelists for the excellent discussion.